Hi, this is Jennifer Golombek. I am going to be talking about the COVID-19 pandemic 2020. The coronavirus is a global pandemic. It is a virus that has now affected over 2,700,000 people worldwide. COVID-19 affects each person differently. It can cause very severe symptoms, even death. It can cause difficulty breathing. We've had a lot of patients on vents from this. There's also patients that have had very mild symptoms, even asymptomatic, and they are just carriers for the virus. In this presentation, my goal is to compare statistics regarding COVID-19 for 4 geographical areas. They are the United Kingdom, the United States, the state of Illinois, and for Sangamon County. The United Kingdom, the first reported infection was on March the 6th. The first death was also on March the 6th with 4 deaths. The highest point of spread reached 5,532 people in one day. That was May 1st. The highest point of deaths in one day reached 986. That was on May the 13th. The end of July statistics, infections were at 745 per day. Deaths were at 69 per day. The United States statistics, the first reported infection in the United States was on February the 4th. The first death was also on February the 4th with 1 death. The highest point of infection spread reached 112,073 people. That was on July the 5th. The highest point of daily deaths was 2,312. That was on April the 16th. The end of July, the United States still had an average of 70,768 daily confirmed infections, and daily deaths in the United States averaged 866. Moving on to the state of Illinois, the first COVID-19 infection came to Illinois on March the 10th. The first COVID-related death was on St. Patrick's Day, which was March the 17th. The highest point of infection spread was a little over 4,000. That was on May the 12th. The highest point of death was 191 people per day. That was on May the 13th. End of July statistics, that was 1,772 infections per day and 21 deaths per day. Sangamon County, the first COVID-19 infection came to Sangamon County on March the 15th. The first COVID-related death was on March the 19th. The highest point of infection spread was 46 people per day in one day, and that was on April the 28th. The highest point of death was 4 per day on May the 8th. End of July statistics, 31 infections per day and 0 deaths per day. So Sangamon County was actually doing really good. So populations at risk for COVID infection and death, the United Kingdom and the United States, they are actually both very similar. The age for increased infection risk is 65 or greater. Age for increased death, that is also 65 and greater. The comorbidities that can increase the risk of an infection, that includes diabetes, hypertension, heart disease, lung disease. United States, the only difference was the risk for death. That was an age of 85 and over. The comorbidities, those were actually all the same. Diabetes, hypertension, lung disease, heart disease. So the state of Illinois, there are people that are at higher risk for infection, 65 and greater. Um, the age that was at higher risk for death is people over 60. It showed in Illinois that 85% of the deaths were over 60 years old. The comorbidities that put someone at higher risk included heart disease, diabetes, chronic kidney disease, COPD, cancer, anyone with a weakened immune system. 55% of deaths come from a nursing home in Illinois. Sangamon County, the age for risk and death is over 65. Comorbidities that put someone at higher risk include heart disease, diabetes, chronic kidney disease, COPD, cancer. Anyone with a weakened immune system is going to be at a higher risk. 28 out of 33 Sangamon County deaths, they came from nursing homes here in the area. When we're talking about the greatest risk for getting the COVID-19 virus, living arrangements, same for all four of the geographic areas. Nursing home residents were at the higher risk. A couple factors, people's age, close quarters, multiple underlying health conditions. Those are all reasons why they would be at the greatest risk. Urban versus suburban versus rural areas. Same as far as all four geographical areas. Any urban area has been hit the hardest because of being so densely populated. The virus is being spread from person to person because they're in such close contact with another. And the virus is being spread by respiratory droplets. So when an infected person coughs or sneezes, it can easily be spread to another person. So if you have someone that's living far away from another, then they're way less likely to get the virus. As far as social economic status, people with a lower social economic status, I have found that they have an increased risk of getting the COVID-19 virus. One example that I found was if someone is unable to afford to take time off because of the virus. I know a lot of people were trying to stay home, to work from home, or stay at home, period. Or if they become sick, they were not able to do that. So if they are going to work, they're being around more people, then they are going to be more vulnerable to get the virus. Now I'm going to talk about the effect that the COVID-19 pandemic has had on the healthcare system. In the United Kingdom, I know a lot of people had been very concerned if we would have enough beds, if we would have enough personal protective equipment during the whole COVID-19 pandemic. It showed that we did end up having enough beds. The bed supply that was available in the United Kingdom was over 30,000. At the highest point of infection, which was on April the 11th, they needed 13,263. So plenty availability of beds. ICU beds that were needed were 1,352. At the as far as the ventilators that were needed, it was 5,893. I believe it was 6,000 that was available. In April 2020, there was a survey that went out to doctors. 30% of the doctors surveyed reported shortages of scrubs. They reported shortages of disposable gowns, and 11% reported shortages of goggles. In the United States, there was an average of 0.64 intensivist and 2.12 critical care nurses per 10,000 patients in the month of May. The Illinois bed and vent supply in May 2020 are as follows. Open ICU beds were 950. Open med surge beds were 12,554. Open ventilators were 3,309. So again, the bed supply was just fine. In April, a survey showed that the PPE was running low. 48% of facilities that were also surveyed reported that they only had a week supply of N95s left. 42% of the facilities surveyed showed that they only had 2 weeks or less of surgical masks. 50% were already out of booties. 42% had only 2 weeks left of the glove supply. 36% had 1 to 2 weeks left of gloves. Now, as far as the healthcare workers, how are they affected during the COVID-19 pandemic? As of April 22nd, in Illinois, 2,500 healthcare workers have been positive with COVID-19. 8 of those actually died of the virus. So in Sangamon County, actual statistics have not been found as far as the PPE. There was an article, according to St. John's and Memorial Medical Center, both. They stated that they had been postponing elective surgeries, non-emergent procedures. They were trying to do everything that they can to preserve the PPE. And at the time of April, the supply was adequate for their staff. I work at Memorial Medical Center. I did the fit testing for N95 for the medical staff, and we were running a little low, but we never ran out. So COVID-19 testing. For the United Kingdom, they started doing their testing on February the 4th. The first confirmed infection was February the 6th. Antibody testing statistics were not found. COVID-19 testing in the United States, that was on February the 4th. In Illinois, that started on March the 4th, and in Sangamon County, that was started between March the 14th and March the 18th. Now, on March the 18th, Sangamon County did report that they had 1 patient at Memorial Medical Center and 3 patients that were recovering at home. So stay-at-home orders, those all started all in March. In the United Kingdom, they were placed at a stay-at-home order on March the 23rd. In the United States, those, of course, did vary. The earliest one was on March the 19th. That was in California. There are still 5 states that have never been issued stay-at-home orders. Those are North Dakota, South Dakota, Nebraska, Iowa, and Arkansas. The state of Illinois and therefore Sangamon County also, those orders were placed on March the 21st. Some essential services in the United Kingdom. People were allowed to shop for food and medical necessities. They were allowed to do 1 type of exercise per day. They could travel to and from work. They were encouraged that anyone who did not have to go to work, they work from home. So critical workers, they were allowed to be at work. They were also allowed to attend funerals. People are uh, were required to wear face coverings when they went to a shop, but shop workers were not required to wear one. The United States, most states had a stay at home order, very similar to each other as far as the non essential businesses were closed for a certain period of time. Of course, healthcare, grocery stores, those were all to remain open. Most of the United States do require face masks, face coverings when they're out in public. For the state of Illinois and Sangamon County, people were allowed to leave home for essential activities like grocery shopping, retrieving supplies, car repair. If you have to see a doctor, work. If you are unable to work from home, you are allowed to care for others. Outdoor activities are approved. Of course, people are required to use a face mask and social distancing for 6 feet. So there's businesses allowed to reopen. The ones in United Kingdom, they did allow more businesses to reopen there, I feel, than in the United States. The United Kingdom opened retail stores. They were allowed to open indoor and outdoor restaurants, bars, pubs, hotels, bed and breakfasts, hair salons, museums, theaters, um, places of worship, libraries. Um, so that was all in the first phase. As far as the United States as a whole, a lot of similarities in that, but each state was a little bit different. Restaurants, of course, they have a limited capacity in which they are allowed to let people come in. Social gatherings are very limited, 50 people allowed indoor, 100 people allowed on an outdoor activity. Retail stores were also allowed to open in the United States. Still to this day, bowling alleys, bars, movie theaters all remain closed. The state of Illinois and Sangamon County was first allowed to reopen state parks, golf courses, garden centers, outdoor seating, restaurants. They were able to start performing elective surgeries again. And then in the next phase, we were allowed to reopen offices, salons, retail stores, and indoor restaurants, of course, with that limited capacity and social distancing. County fairs, state fairs, concerts, anything that would allow for a large crowd, those have been canceled this year. Movie theaters, those are still closed. So unemployment rates in the United Kingdom, those show that they have not really been affected. When we're looking at January 2020, before the virus hit, the unemployment rate was at 4%. In March, so that's really when it just started, the unemployment rate was 3.9. I did not find anything after March on the United Kingdom. The United States economy, it did decline since COVID-19. Nearly 40 million American workers have been unemployed due to businesses closing. Each state has seen a decrease, an increase in unemployment rates from May 19 to May 2020. The state of Illinois went from 4.1% in May 2019 to 15.2% unemployment rate in May 2020. Sangamon County had an unemployment rate before COVID-19. That was in January 2020 at 3.8%. In March 2020, it had gone up to 13.3. 3 months later, after the businesses started to open back up, We have dropped those numbers a little bit, and those are to 12% at this point. So the educational institutes, the United Kingdom, those they closed their schools on March the 23rd to all students except for parents, students of parents that are critical workers or to vulnerable children. They were still allowed to go to school. The United States, they issued a mandatory school closure in 48 states, Washington, D.C., and to 5 of the U.S. territories, which include American Samoa, Guam, Northern Mariana Islands, Puerto Rico, and the U.S. Virgin Islands. The state of Illinois closed all in-school learning institutions across the entire state, and that was on Friday, March the 13th. All of our students did remote learning until the end of the school year. So, in my opinion, what has been successful during the COVID-19 pandemic? Everyone has been so busy in their lives. We're all running 100 miles per hour. People have really had to slow down, and they've really had to spend more time with their family, which is a good thing. Another good thing, stage 3 in Sangamon County, um, we did show a big decline of infection numbers before the reopening of stage 4. So I think we know how to slow the progression of the virus, which is good. Also, we went a whole month without a COVID-19 related death. So I think that's a very successful thing during this pandemic. We've had a lot of businesses that have not done well during the COVID-19 pandemic. Then again, we've also had very good um, financial benefit to other businesses, Walmart, Target, things that have really had essential services. They've done very well. Employees of like Walmart, they've received hazard pay. So we've had some businesses that have truly done really good. Hobby stores, they've increased businesses because of masks. People are making their own masks. Um, so I think everyone has kind of come to realize how important everything is in their lives. So to me, I think that's really a successful thing. So community health services for nurses during a pandemic. Um, Testing for virus, of course, that's a big thing. Um, we do a lot of testing now for COVID-19. We're going to do a lot of immunizations when it becomes available. Home health nursing for patients that are unable to leave the house. Providing education regarding the pandemic and infection spread. I'm sure there's going to be a lot of education needing as we learn more and more about how the virus is spreading. I know at this point we don't know a lot about the virus since it's so new. But as nurses, one of our jobs is to educate. So I'm sure that's going to be a big part of our jobs. Thank you.